Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello,
Hello,
how are you, sir?
I am good. How are you,
I'm
Bhavana?
good. I'm doing good. How's everything back in Mumbai?
I would say that's much better. What about you over there?
It's good. It's good. New York is going good.
Yeah.
Everything good. So, sir, can you tell us? So, first of all, let me start by thanking you. Thank you for taking the time and doing this with me. Like I was telling you a bit sometime back, that in US the community of healthcare professionals, it's so strong, and I love the way they connect, they help, they network. It's very inspiring to see them do so well in whatever field of healthcare profession they are. So I thought of this initiative, and I wanted to connect the people who are experts in their field, like you yourself. You're doing so great in sports PT, and it's so inspiring because I still keep calling. If you know my batchmate Pezan, I still keep calling him. I'm like, tell me how is on field different, what tricks you use, how do you stretch, how do you relieve. And I love knowing that aspect of sports PT. So you taking the time out and just doing this session with me, it's really great. So thank you so much.
Appreciate it and welcome. I'm glad to, join this session and definitely looking forward to hear something good from you as well.
Sure, why not? Okay, let me start by asking you. You are in sports and fitness. So, what, according to you, is the meaning or the definition of sports, of sports fitness, of sports health? How would you call a person healthy?
Uh, for me, sports is something like that, doing a physical activity,
Right.
especially with the high intensity, and by which you can give the best of yourself in the performance.
Right.
Okay. And talking about fitness, fitness is altogether different. Sporting is, I would say, different, and fitness is different. Nowadays, the concept of fitness is altogether in India
Right.
is different, I would
Mhm.
say. But yeah, when we talk about sports, it's particularly into the games, most probably. And we see a lot of youngsters, doing well around during the games right now. Yesterday also, I think you might have seen India almost had 107 medals.
Yes, I saw in the morning. I woke up and I saw that they're winning gold. They're going on winning so
Yeah,
many in the Asian Games.
yeah,
Yeah.
yeah, yeah.
That's very proud. How do you feel when you how do you feel personally when you get a chance to represent the sports and the even if it's a smaller sport or a growing sport, how do you feel when you get to represent as a PT?
So I would say it's a proud moment for sure to represent the sport, especially now. It's been a long time I'm working in kabaddi.
Right.
So I meet a lot of new young players. There are some existing players, and there are some experienced players. So altogether, if I make it a complete package, it's exciting, it's fun, and definitely you see new things going ahead in terms of injuries, in terms of performance,
Right.
in terms of training. Every season we see new things going around. And definitely the experience working with the team is damn cool, I would say.
So can you tell us a bit more about your experience in Pro-kabaddi? how did you start? How do you go about the training sessions? Just in general.
Yeah. So basically, I started working in Pro-kabaddi in 2019 with a pre-season training camp where I was working as a junior therapist in Mashal, I would say. So I was very excited, that I'll see players and I'll see different type of injuries. And so we as a physio, we work on more of cold cases, I would say, and also the chronic ones. But when you step into sports, the scenario is altogether different.
Correct.
You see a lot of new acute injuries, especially some of them are, uh, very dangerous as well, such as concussions, dislocations. So, as a sports physio, I think you should be a package for sure. So, when I started, and definitely for me, I would say I was scared initially, because during the graduation and post graduation, we get opportunities to work in India for sure. But once you have that responsibility on you, is altogether different, I would say.
Right.
So I started in 2019. Then there was a COVID season, which I did in the bubble. So if we talk about the teams, it's like initially there's a pre-season training camp, which we go ahead. So right now I'm expecting one the upcoming season for the Pro Kabaddi. So the initial few days, what we do is like it takes around 5 to 7 days to evaluate the athletes, and there are some fitness tests such as the agility test, the musculoskeletal training, and the endurance test going around for few days, and for which we make them. We actually see that if they are fit to go out for the season. So
Right.
once we are good on this, and if we are okay that he is not having any serious injury for which there can be a chance of dropout during the season, we go ahead with the players. Once the training starts, it is divided into two things. One is kabaddi, and the other thing is fitness, I would say.
Right.
So there's a weekly schedule which is made for sure. So during the season, we start initially with the fitness, with the strength training sessions, and those agility drills initially. So initially, there is a one session of strength training, agility training, and evening they have their skill training. So kabaddi is a lot of, if you I don't know if you watch or not, but it's like a game there in which there are two types of players. One are raiders and one are defenders. So the raider is one who goes and touches the player and come back. Okay, so they have to be super fast, super fast. Sometimes they'll say something called as a bonus also in kabaddi. It's so quick that it's fraction of a millisecond you missed it, and I don't know how the referee notices that
Wow.
sometimes. So yeah, so that's fun. So they practice their skills, they try to enhance them, and they try to make sure that they are top of the board during each and every season.
Hmm.
So this encompasses of most of the pre-season training, I would say. And during the season, yes, it's fun, it's exciting, it's like a mixed package, a
Right.
stadium full of crowd, people cheering for their team, and those 40 minutes are like super tense for each and everything, I think so. So during those 40 minutes, either you lose or either you win. But no matter what it is that the effort put by your team has to be the best, is what we do.
This reminds me of the dialogue that Shah Rukh Khan says in Chak De India.
Yeah, yeah.
You must be
So it's a
feeling.
lots of adrenaline rush and lots of emotional rush going around up and down
Yeah.
through those 40 minutes, definitely.
So do you remember the dialogue?
I don't think so. What was that? There's 90 minutes, all you're saying. Yeah, yeah, yeah,
70 नहीं कितने something like that, yeah, 70 minute half के लिए.
yeah.
Yeah,
Yes,
that
yes, yes.
that's fun. That's so exciting. Like for a match to be a part of a match that has like you said, it has, you know, emotions, and it has passion, and it has competition. It's such a good spirit to
Yeah.
have, and such a good thing that you get to see it so close, just to work with the players so closely, and it's really fun. Can you tell me more about like the training that you do you focus more on, I know it's different like you mentioned, but would you rather focus on strengthening or flexibility or agility, or like individual training, or like a combination?
So, I would say during the season we have something known as a strength and conditioning coach. So
Right,
they mostly are hired for, working on the agility drills and endurance, especially. So we as a physios, our job is to see the joints. We need to, work through I would say, most of the injuries. Okay, and we have to make sure. So as I said, right, we do a pre-screening evaluation during the season. So we have some players who have ACLs, who have ankle sprains, recurrent history of ankle sprains, recurrent history of shoulder dislocations. So those are the ones who need individual training, I would say.
right,
Rest of them, yeah, rest of them usually they do practice with the whole team.
right.
But when it comes to a injury where we feel, this suppose there's a history of sprain, okay, and we see that there's a laxity in the ATSL. So we definitely take the individual sessions. We try to, strengthen the structures all around the ankle, say tibialis, peroneals, those gastro, soleus.
Mm-hmm.
Again, comes with some proprioceptive training, some balance training, some change of direction skills which we do. So we definitely look forward to, maintain the joint stability, the strength, and definitely the last thing is that we prepare the structure so strong that it should, move in each and every direction. Having forward that, they don't go out for an injury.
Talking about injury, what are your steps towards prevention of injury? How do you try to prevent, or even if it's after, how do you deal with an injury for a sports person?
I think that's a bigger picture which we talk about. I would say, um let's come to a smaller picture about that. We have some recent advances, which we go through. As a sports physio, we have to, study. We have to make sure that, we are up on the board. So we have some guidelines, such as American College of Sports Medicine.
Mm-hmm.
So basically, we keep on reading those guidelines. So hamstring strains are the most common in each and every sport, I would think. So we have an prevention program for hamstring rehab. So in which we do Nordic curls, we train those hamstring, which start with isometrics. We go for the isotraining, then definitely some sports specific drills. And for me, it's especially, I would see that it is trained as such that, it is capable to perform during the sport. Suppose there are two athletes, so one is a kabaddi player and the other one is a footballer.
Right.
So for each, the movement of the joint is different. The direction of the joint is different.
Mm-hmm.
So we have to train accordingly, So for a footballer, it's more of a sprinting kind of a thing. But if you look into kabaddi, they stand a bit with their hip knee flexion, and there's a constant isometric pressure during the, match or the training. So I would say it's a constant pressure during those 40 minutes or whatever they train. So coming into a smaller picture, yes, it's So if you ask me, strength training is important, plyometric training is definitely important,
Correct.
and injury prevention so comes with a lot of things, I would say. First of all, if in case we are looking forward with an uninjured athlete, we assess that the strength is that much that he can perform a particular goal.
Right.
So there's
Have,
something. So I focus.
you're right.
Sorry.
You're completely right. Having a passion towards the sport, like the way you mentioned the hip knee flexion, I notice it, but it's not constant on the back of my head. And you really have the passion for the sport, so that plays a very very big role.
Understanding the sport is really important.
Right.
So, being a sports physiotherapy, I think so. You should always see the athlete, what kind of posture he is in. Is it in a correct posture? If not, what's going wrong in the posture? You need to correct and you need to fix it so that there are less chances of injuries, I would say.
Right, true. I try to use that in my patients out here in outpatient, but they're not athletes. They do train themselves. Fitness is a big thing here, and people come to me that just for prevention. So that's where I get a little. We all we can do is stretch. All we can do is keep training. But how do you keep it exciting? How do you keep it like engaging for the client or the patient?
So, I would say it's much more of a sport. Okay.
Mm-hmm.
So, suppose you're working with a footballer, right?
Right.
Uh, if you just give him weights, he won't be happy. You have to understand what his liking is. I understand definitely strength training is important,
Mm-hmm.
but I think so. For us, the job is to make the exercise more fun. The more fun you bring into the exercises. So suppose we are doing a balance and proprioceptive training, right, for a sprained ankle or a knee, whatever it is.
Right.
Okay, so suppose we take a Bozu ball, okay, and we ask him to stand, and with his standing posture, we just give him the ball and we ask him to kick in various directions. So we work with the balance and proprioceptive training as well, and we make it the fun as well.
True. How much do you think diet comes into role? I know diet is very important, but how do you help manage the diet aspect of players?
So diet is really important, I think so. So I keep on having talks in the hospital, outside hospital, and I'm trying to create an awareness in terms of recovery. So we, as a non-athletic population, we don't focus on recovery, right?
Right.
We only try to perform. Okay. So when it comes to sports, it's altogether the same. So most of the sports, we have two type of population in India. There are some vegetarian population and non-vegetarian population.
Correct.
So we need to make sure they're having enough protein.
Mm-hmm.
We need to make sure they're having enough of carbs in their meal. They are avoiding sugars during the seasons. They are having a proper hydration during the seasons. So all of these small things are really important when it comes to diet and performance. So definitely sports nutrition is an upcoming field as well, and it plays a vital role for the same. I think.
Is it like a certification or it's like a degree?
I think there are some certification courses. I met a lot of sports nutritionists. So I think they are doing well, and they definitely have those enhanced skills rather than a normal dietitian, which can enhance the performance of an athlete definitely.
Right.
So I think it's more like a course test, not a degree course, I would say.
Right. Other than sports and being a sports PT, you also associated with one of the top hospitals in India. So can you tell us more about the experience that you have there?
I feel the experience there is definitely good for sure. I meet a lot of people. So I see most of the population, which is a mix of, orthopedic and sports in the hospital. Because I see a lot of, I would say something surprising, which is dancers. So dancing, I see a lot of dancers coming in during the hospital,
Right.
so I see their passion and their work. They work 16 to 18 hours a day,
Mm-hmm.
constantly putting the pressure on performance. So definitely they are more prone to injuries. So I like to communicate with them. So I ask them what kind of um, activity or routine do you follow?
Right.
So definitely it's more aggressive and hectic. So due to which they have some injuries. And during the hospital, I would say I enjoy my work.
Right. And I remember first time I was doing my internship in Manhattan, and I come across a few cases, and we're talking, and I'm asking, "What's your profession? How did you get injured?" And then they're like, "We're dancers, we're pole dancers, and we do a lot of spinning," and I'm like, I don't know how to associate with it because I never came across anything like that. I came back.
Yeah,
I was on Google that night and I'm like, pole dancer injuries. And oh my God, I was like blown away with the type of injuries that they come across. And there are so many professions that we don't know, and we as PTs can be spread so wide with them. We can help any profession because injury can happen in any profession.
correct, correct. I feel it's constant learning throughout. I say it's lifelong learning. The more variety of cases you see, the more variety of things you learn.
True. What are your next goals towards life in general? What is next on your list of achievements?
Uh, right now, so I don't think I have thought that much, but definitely I would like to work in cricket. So I have been working with kabaddi. I have worked in badminton.
Right.
I have recently worked in table tennis. So for me as a PT, the more variety of sport I explore, the more variety of learning happens to me. So learning is fun.
Yeah.
Definitely with athletes, it is very fun. So the main thing with athletes is they will never be crying or maybe disappointed with the injury.
Mm.
So suppose there is an injury to an athlete. The first thing he'll say and ask you is, "Sir, when can I get back to my sport? Can I play tomorrow morning?"
Yeah.
Forget about his injury. Okay, if he's limping as well, he'll say, "I'm okay. You just give me a drug, or you do
Yeah.
something that I can play those 40 minutes." Uh, so the fun and excitement when working with athletes is way more different than working with those day-to-day life people. So that pain tolerance level is too high. So and also they are very focused to an aim
Right.
with their sport.
Right.
So though more variety of athletic or sporting events happen, I am keen towards learning and enjoying those things as an PT, I would say.
That's very exciting. And like you said, the sportsman spirit that only a sportsman can have. You cannot see that in regular man, for sure. I'm very excited for you. I'm happy to see where this leads you to in your career and in your life. What is one
Okay.
thing that you would like to tell the 18-year-old Niraj that you should have done this, you should not have done this?
Uh, I I would say that. So I was an athlete myself. okay, during my schooling days. I would say an 18-year-old Niraj, you should have not left that sport which you were playing with. You should have continued. Today, you might be at the next level. But definitely, I'm much more happy being on this side as well as a PT and associated with sports.
But you would have like to join or continue your sport.
Yeah,
Yeah, that's very fun to know. That's. I didn't know you played at. Well, I know because there were very less boys in the college, so everyone had to play every sport. That is what I remember, especially when we had matches. But
yeah.
what did you play?
I used to play volleyball.
Oh, oh, I remember. VK sir used to always team up with you.
Yes, yes. So I was a volleyball player during my schooling days. I used to play for Mumbai as well.
Oh, wow. That's exciting. Maybe you can go back now.
I think it's too late to sit in over there.
Okay. Okay. What is one message that you would like to give us today? Um, Especially to a lot of people. I know there are so many juniors over here, and there are so many people from our batch who have an affinity
Yeah.
towards physical therapy. If they want to start their career, what message would you like to give them?
I would say for a physical therapist, anatomy is really very important. You know,
Right,
if you so as a physical therapist, anatomy is something which 24/7 should be in your brain.
right.
Okay. So for those PTs, I would say focus more on of anatomy,
Mm-hmm.
palpate those structures. So I feel physiotherapy is doing very good nowadays, but still I would say it's lacking somewhere in terms of surface anatomy, when it comes to surface anatomy. So the more of skills which you can develop during your undergraduation and post-graduation, the higher are your chances to be a good sports physiotherapist, I would say.
Hands-on. Important. Yeah.
Yes, yeah,
I, I I know I feel you because when it comes to theory, still, I think we're doing better. We're doing good. But when it
yeah,
comes to hand, the confidence, we it takes time to build that confidence. It takes time to
yeah,
so you have to palpate so many bodies to know where is what and is it normal or is it abnormal feel. So
yeah,
I agree with you 100%.
yeah.
Well, thank you so much, sir. One last message that you would like to give everyone who's here.
Uh, I would say all the best to everyone and hope you achieve what are you dreaming for.
Thank you. Thank you so much. Thank you for removing the time out and doing this with me. And it was lovely talking to you after so long.
Same here, Bhavna. And I see you doing good. All the best to you as well for
Thank
your future.
thank you so much. I have a few exciting plans coming up, and I'm very excited to start with a few more things coming week. So I'll keep you
Yeah,
posted and I'll stay in touch with you, sir.
so, so
Thank,
thank you. Best wishes to you as well for
thank
everything.
you. Okay. Good,
Yeah,
sir.
yeah.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.